testosterone, also called andropause. Why you need to balance your testosterone hormones. What is low testosterone? Testosterone is the primary male hormone or androgen, okay? Low levels of this hormone is also called hypogonadism or andropause. Benefits of having balanced testosterone. First of all, to develop male reproductive tissue, you do need testosterone. The next benefit is cardiovascular, to balance your cholesterol so that it can lower your LDL and increase your HDL. So LDL, no cholesterol is bad, but you need your LDL to be about 100 and your HDL to be 50 or above, okay? Women even higher. So you need testosterone to do that. To keep you insulin sensitive. This reduces your risks for metabolic diseases such as diabetes. So the more insulin sensitive you are, the healthier you are. It helps increase and maintain muscle mass. So if you want to build muscle, you're going to need testosterone. It helps with libido and helping the male organ work. Increases cardiac contractions, dilates coronary arteries, okay? So you don't want narrow arteries at all. You want your heart, when it contracts, to be an efficient contraction. Testosterone helps with that. It also reduces inflammation in the body. What are the target organs for testosterone? There are many. You start with the skin, just for hair growth and sebum production. You need testosterone for that. In your brain, for libido and for assertion, you need testosterone. Again, muscle, here we go again. Increasing the strength and volume of your muscles, need testosterone. In the kidneys, to stimulate production of red blood cells, erythropoietin, they need testosterone. The bone marrow and bone both need testosterone. Male organs, like we talked about, and then your liver to produce serum protein. And what are the symptoms of low testosterone? The most common one is fatigue, almost chronic fatigue. You wake up tired, you're tired during the day. It doesn't matter if you eat well or you sleep well, you're tired all the time. And then low libido and low function of the male organ. You can read that first line there. And then there's an increase in belly fat, so your tummy gets really big and you develop tissue in your chest, more feminine tissue in your chest. There's sluggishness, both physically and a lot of brain fog with it. When you get your coronary calcium score, usually when you turn 50, your doctor sends you for a coronary calcium score. It can come high if your testosterone is low. And this also is why the biggest benefit for testosterone, believe it or not, is your cardiovascular health. Metabolically, you can have high blood sugars, readings above 90 or 100 are considered high, and then your hemoglobin A1C would be 5.5 or above. You want your A1C between 5 and 5.3. Anything over that is you're crawling in the wrong direction, in my honest opinion. And another common one is depression, grumpy mood, and lack of motivation. They don't want to do nothing. They just want to lay around and watch TV. Factors that cause low testosterone: aging. It just comes with the territory. You're getting older, your testosterone is going to drop. Chronic emotional or physical stress. So really manage your stress. If you need to talk to somebody, do that, because it is affecting your testosterone. Processed foods or high carbohydrate diet, goes without saying. Low vitamin D and zinc. A lot of people don't know that, but manage your vitamin D levels. I'll let you know what levels you need in the next slide. So common medications that people take that affect their testosterone. Statins, so all your cholesterol medications, you got to watch that. I'm not saying get off your meds, but just be aware that this may be happening. Narcotics used for pain can cause low testosterone, and also SSRIs, like antidepressants. Now, does this mean get off your medications? No, but dose your testosterone accordingly, knowing that those medications are on board, okay? How do you diagnose low testosterone? The first one is the questionnaire. So it's been my experience, like, male patients will not talk a lot about their symptoms. So it's better to give them a questionnaire because it triggers them to talk about things they didn't even know may be affected by testosterone. Second, lab work. And the basic lab work for men is free and total testosterone, sex hormone binding globulin, SHBH, PSA, and the 3% PSA that pays attention to the prostate gland. We need to make sure that the prostate is okay before we put any testosterone on it. We want to check estradiol and make sure that even though that's a female hormone, we want to keep it under 35. If it's higher than that, we want to make sure the patient is not converting. Vitamin D, we've talked about that. It's very important because it's a pro-hormone. Check a full thyroid panel, even though men usually do not have thyroid issues, but we've got a few. So check that. And not just the TSH and free T4. Make sure you check the free T3 as well. A lot of people are poor T4 to T3 converters. So you want to check a full thyroid panel. And then CBC and CMP, most doctors check that. Prolactin, so before you start anybody on hormones, you want to make sure you know what their prolactin level is. And then as usual, hemoglobin A1C and fasting insulin, that's checking your blood sugars and how you're managing your insulin and glucose. What are the desired levels? Now this is what's more important on this slide is the level. I need you guys to own this for yourself. When you look at LabCorp, it gives a very wide range for testosterone levels. You need your testosterone to be over 500 nanograms per DL if you're going to have any of those benefits I mentioned, especially cardiovascular. Anything below that, you're not getting any cardiovascular benefits. So 500 nanograms per DL minimum, okay? Your free testosterone, 15 nanograms per DL or more. Estradiol needs to be less than 35, and your vitamin D needs to be about 50 nanograms per DL. How do we treat low testosterone? The easy one that everybody knows is intramuscular injections once a week. There's also gels, and there's also compounded creams. The gels are what you get at your regular pharmacy, prescribed by your doctor. Compounded ones are also prescribed by your doctor, but I prefer those because they're daily application, yes, but they can also be very metered dosing to the patient's testosterone level, because not everybody's levels are low the same way. So if you tend to have super low levels, you're going to have a stronger prescription, and the creams do that very well. Implantable pellets, they are more set it and forget it. They're supposed to last about 6 months. We put them in the glute or in the flank on the side. The flank is the newer but more preferred site to put these pellets. We do numb you and put them in there. They last 6 months, but for about a week, you cannot exercise when you have pellets put in so that they don't extrude. But after that, you don't have to do nothing for almost 6 months. And then there's the HCG prescription for any males that still want to have children. So if you still want to have children, you have to keep your sperm count high. And to do that, testosterone is not the way to go. Okay? All right. Here are the supplements that help with your testosterone therapy. Vitamin D3 plus K2, about 5,000 international units a day. It's fat soluble, so take it with food. The K2 helps push the mobilized calcium back into the bones because high dose vitamin D3 mobilizes calcium, okay? Now, is 5,000 for everybody? You may need more if your vitamin D is low. So, or you may need less if your vitamin D is high. So that's why we check the labs and dose accordingly. Zinc 20 milligrams. Why? The 50 milligram dose that people often find in the pharmacy is for when you are actually ill. Maintenance dose for zinc is about 20 milligrams so that you don't displace your copper in your body. And then DHEA, which is a hormone that helps support testosterone, you can get 25 to 50 milligrams orally for men. Women's dose is lower. Women's dose is 5 to 10 milligrams. Okay, even though this video is mainly aimed at men. Women need testosterone as well, but that's another video. All right, so now we've treated you with testosterone. You're feeling great. What do? We need to check your labs every 2 months, and then every 6 months, and then every year. Why do we do that? Couple things. We want to check that PSA to make sure that your prostate is not getting larger. If it is, we either need to reduce the dose or stop altogether. Okay? Gynecomastia, that is a female tissue on your chest. I can't say the word here on YouTube, but you can take a supplement called DIM, about 100 milligrams, and it'll help lower that number. If it's not getting under 35, which is your estradiol level, then you either need to reduce the testosterone dose as well. Erythrocytosis, this is when your red blood cell count goes high, because remember it affects the bone marrow. We talked about that. So if you're one of those that's converting too high, you either can donate your blood or reduce the dose or change the delivery system. If you want in injections, maybe try creams. That helps as well. And then sometimes you can suffer decreased sperm count. This is not an issue for men that don't want to have children, but young men that want to have children and they have low testosterone, they may want to use HCG and not testosterone. And that's it, guys. I will see you on the next one.